Hi, my name is Grace. I had sections 17.4 through 17.6, so I'll go ahead and get started. For 17.4, it covers the ovarian and uterine cycle, so I'll go ahead and start with the ovarian cycle. So the beginning of this section goes over oogenesis, which is the production of an egg in females by the process of meiosis and maturation. Oogenesis in females produces egg cells and polar bodies. Polar bodies occur in oogenesis as a non-functional product of oogenesis. So 2 to 3 meiotic products during the process of meiosis are polar bodies. The ovarian cycle is the monthly follicle change during monthly follicle changes occurring in the ovary that control the level of sex hormones in the blood and uterine cycle. The ovarian cycle is controlled by the hypothalamus and the anterior pituitary gland in the brain. During the first half of the ovarian cycle, the hormone FSH from the pituitary gland causes maturation of a follicle, which is a structure in the ovary that produces a secondary oocyte from oogenesis and the hormones progesterone and estrogen. The follicle secretes estrogen and some progesterone. The next phase is after ovulation, and this is the release of a secondary oocyte from the ovary. If fertilization occurs of that, this secondary oocyte becomes an egg. In this second half, the hormone LH from the anterior pituitary gland converts the follicle into the corpus luteum, which is the body that forms in an ovary from a follicle that has discharged its secondary oocyte. So it secretes progesterone and some estrogen as well. The corpus luteum then secretes progesterone and some estrogen. The ovarian cycle ceases when a woman reaches a point in her life when menopause starts, and menopause is the termination of the ovarian and uterine cycle later on in life, like mid-50s to early 60s. Sometimes it happens before that, though. And then the uterine cycle, so estrogen and progesterone regulate the uterine cycle, which is the monthly occurring changes in the uterine lining. Estrogen allows the endometrium, which is the mucous membrane lining the interior of the surface of the uterus of a woman. It allows the endometrium to rebuild after ovulation. Ovulation usually occurs on the 14th day of a 28-day cycle for women. Progesterone produced by the corpus luteum causes the endometrium to thicken and secrete any fluid that needs to be released. And a low level of hormones causes the endometrium to break down as menstruation occurs. Menstruation is a loss of blood and tissue from the uterus at the start of a uterine cycle. All right, so we're moving on to section 17.5, which is all about contraceptives, birth control, and causes and treatments for infertility. So as far as contraceptives, there are birth control methods that reduce the chance of pregnancy. Some examples of contraception are the birth control pill, an intrauterine device, a diaphragm device, and a condom. Contraceptive vaccines, implants, and injections have become increasingly popular over the years because they're so quick and easy. And then surgical procedures like vasectomy and tubal ligation make an individual sterile. I've heard that tubal ligation can be reversed, but I didn't look into it that much, so I'm not 100% sure. As far as infertility, it may be caused by factors like endometriosis in women, which is a condition in which the cells of the endometrium migrate outside of the reproductive tract. And one of the main factors in male infertility is smoking. And couples who are experiencing infertility have the option for assisted reproductive technologies. So some examples of this would be artificial insemination by donor, in vitro fertilization, gamete intrafallopian transfer, or intracytoplasmic sperm injection, which can all be done in a doctor's office. All right, and then for my final section, 17.6, is all about STDs. I know more recently they've been referred to as sexually transmitted infections, but as far as the textbook goes, it is still considering them diseases. So STDs can be caused by viruses, bacteria, fungi, and or parasites. So the STDs that are caused by viruses are AIDS, genital warts, genital herpes, and the 6 variations of hepatitis. So AIDS stands for Acquired Immunodeficiency Syndrome. It is caused by HIV and is transmitted via body fluids, but it can also be transmitted through blood, like exposure. It is characterized by the failure of the immune system. And then genital warts are caused by the human papillomaviruses, commonly seen as lesions on the genitals. Genital herpes can be caused by the herpes simplex virus. Type 1 causes like cold sores or fever blisters around the mouth, and type 2 causes ulcers to appear on the genitals of both sexes. Hepatitis, it has 6 known variants, so it's A, B, C, D, E, and G. It's known for infecting the liver and can lead to liver failure, liver cancer, and if not treated, death. Hepatitis A is usually transmitted through contaminated and unclean drinking water, but it can be transmitted sexually as well. Hepatitis B is spread through sexual contact and blood transmission. So that's it for the viruses. And then STDs caused by bacteria are chlamydia, gonorrhea, and syphilis. So chlamydia is caused by the bacterium Chlamydia trachomatis, usually asymptomatic in women, and men are usually diagnosed by experiencing a mild burning sensation upon urinating. Gonorrhea is caused by the bacterium Neisseria gonorrhoeae. Males may be diagnosed by pain while urinating or greenish-yellow urethral discharge. In women, latent diagnosis may lead to inflammation of the pelvic area, which is pelvic inflammatory disease, or PID, and it could eventually cause damage to the uterus, the ovaries, and other reproductive structures. And syphilis is caused by the bacterium Treponema palladium. Although there are 3 stages of syphilis, the most important, if it's not treated in the first stage, if it goes to the second stage, there can be rashes on the palms of your hands or on the on the bottom of your feet. And after that, the 3rd stage, there's hair loss and gray patches on the mucous membrane. So like your eyes, your mouth, genital area. And if it's not treated for a really long time, it can cause cardiovascular aneurysms and destructive ulcers anywhere else in your body. So just practice safe sex, basically. But that is all for my presentation. I only use the textbook for my sources. So yeah, thank you very much.